the different parts of the body. So let's have an overview of the venous drainage of the spinal system. Venous, venous drainage of spinal, venous drainage of spinal cord. Let's have this animation related to
Stop taking meeting notes and let ClickUp AI Note Taker do it for you. It allows you to focus on your meetings, not your notes.
Hey guys, this is Peter from Anatomy Zone, and in this tutorial we're going to take a look at the blood supply to the spinal cord. So I'll first look at the arterial supply and then I'll move on to the venous drainage. So with the arterial supply, essentially you have two sources which supply the spinal cord. You've got one source which arises at the level of the medulla oblongata inside the cranial cavity and gives off branches which descend vertically down the length of the spinal cord. And you've also got vessels which feed in at each different segmental level. So these are the segmental spinal arteries, or the feeder vessels, as they feed in at each different vertebral segment. So first we'll take a look at the vertical vessels which run the length of the spinal cord. So looking at this model here, with the vertebral column, the spinal cord, and a few blood vessels, you can see the vertebral artery here coming off the subclavian on either side, and we'll just take a look at the right side, and you can see that the vertebral artery rises up and passes through the transverse processes of the cervical vertebra. So this vertebra here is C6, and the vertebral artery passes first through the transverse process via the transverse foramen and ascends up towards the cranial cavity. So after entering the cranial cavity through the foramen magnum, the vertebral arteries anastomose to form the basilar artery, but what we're interested in is the vertebral arteries giving off the anterior spinal arteries. So you get this anastomosis coming off the vertebral arteries on either side, and this forms the anterior spinal artery. And this artery runs down the spinal cord its entire length, and it runs anterior to the ventral median fissure, or the anterior median fissure. So that's one of the vertical vessels. The other two vertical vessels are the posterior spinal arteries, and you've got two posterior spinal arteries. Now if we just rotate the model round so we can look at the posterior aspect of the spinal cord. So posteriorly, you've got two branches given off from the vertebral arteries, which form the two posterior spinal arteries. So these run the length of the spinal cord down the posterolateral aspect of the spinal cord. So you've got one anterior spinal artery and two posterior spinal arteries. So these are the three vertical arteries which originate in the cranial cavity and descend the length of the spinal cord. So now we'll take a look at the second arterial source to the spinal cord. So this is from the segmental vessels, and they're called this because they feed in to the spinal cord at each different segmental level. So they enter via the intervertebral foramina along with the spinal nerve roots, and these segmental vessels are given off by different vessels depending on the region of the spinal cord that they supply. So in the cervical region, you've got the vertebral and deep cervical arteries which give off these segmental spinal arteries, and then in the thorax you've got the posterior intercostal arteries which give off these segmental arteries, and in the abdomen the lumbar arteries give rise to the segmental arteries. So for simplicity's sake, I'm going to zoom in to the thoracic spinal region, and we'll take a look at the segmental blood supply there. So we're looking here at the thoracic region of the spinal column, and what you can see is that I've removed one of the thoracic vertebrae, and you've got the thoracic.
So it was the blood supply of the brain. Let's have an understanding of the let's have a better understanding of the blood supply of the brain. So circle of walls, blood supply of brains. In blood supply of brain, it is the anterior cerebral artery, middle cerebral artery, that supplies blood to the brain, posterior communicating artery, posterior cerebral artery, bilateral artery, internal catharite artery, vertebral artery. So let's have an overview of the vertebral artery related to what its functions are, and what it plays a major role in providing a blood supply to the brain. Vertebral artery. Vertebral arteries run through the spinal column in the neck to provide the blood to the brain and the spine. The vertebral arteries are part of the circulatory system, that is we call the cardiovascular system, and the heart and the lungs and the organs involved in it. For example, arteries, veins, capillaries that carry blood, oxygenated blood from the heart to the different parts of the body as well as brain. They carry blood to the brain and spinal cord, which form the part of the nervous system. arteries of the brain. We have discussed 15% cardiac output to the brain provide the brain with 20% oxygen now used by the brain have a normal blood flow of so it is a major MCQs. What is the blood flow in the brain? The blood flow in the brain is the 50 to 100 mlg of the brain tissue per minute, while the basic blood pressure of the human body is I think 120 to 80 milliliter per gram. So it is a major MCQs that we can try from here. Arteries of the brain consist of two parts: internal carotid artery, vertebral arteries, and internal carotid arteries and vertebral arteries enter the cranium via a carotid canal of the temporal lobe lies with the cerebellum sinus at the spinal cord. Supplies middle arteries, ophthalmic arteries, the eye. Ophthalmic arteries that provide the blood supply to the eye is central artery of the retina. It occurs at central eye of retina that provides the blood supply to the retina part of the eye. Posterior communicating antenna rises from carotid spine and joins the posterior cerebral artery. And so after it is the anterior carotid artery and anterior cerebral artery. Let's have a basic overview of the functions of both these arteries. Anterior carotid artery. Anterior carotid artery is most important. Anterior carotid artery being one of the most clinical relevant and vital arteries supplies oxygen to the critical substance such as brain and eyes. A carotid artery, what is the main function of the carotid artery? Supply oxygenated blood to the parts of the brain responsible for thinking, speech, movement, and sense of touch. So, anterior cerebral arteries give drugs branches to the optic mechanism, supplies the medial surface of the frontal and capsule via a medial striate artery of Henbra supplies the lung and foot area of the motor and sensory cortex. Anterior communicating artery, middle cerebral arteries, or the vertebral arteries. In the vertebral arteries, there are the anterior spinal artery and posterior spinal artery, and basial artery. Let's have an overview of the basial artery related to what is SBSILA, basilar artery. Basilar artery is a curical blood vessel at the base of the brain formed by the joining of the vertebral arteries and supplies oxygenated blood to the brainstem, cerebral, posterior cerebrum, controlling vital functions like consciousness, breathing, and balance. It is blockage known as basilar artery occlusion is a life-threatening emergency causing severe neurological deficiencies. So basilar arteries, the major function is to provide the oxygenated blood to the brainstem, cerebellum, and posterior cerebrum, controlling vital functions like consciousness, breathing, and balance. And its blockage can cause some neurological condition, including death also, as these parts of the body, brainstem, cerebellum, posterior cerebrum, and are responsible responsible for breathing, balance, heart rate, consciousness, movement of the diaphragm, oxygenated, deoxygenated blood, breathing, and etc. like factors. Vascular artery, we have discussed the vascular artery. Meningeal arteries, veins of the brain, venous, dural, sinuses, angiography. Let's have an overview of the angiography of the brain, after which this chapter is over. Angiography of brain, angiography, angiography, angiography of brain. First, look at the tests that we can conduct in the brain. Angiography, angiography, angiography of brain. Sorry, brain tests. Brain tests, medical. So in the brain test, the main one is the EEG, electrocardiogram for electrical activity, diagnosing sleep issues and electrical activity of the brain, imaging, MRI, CT scan of the brain, neurological examination of function, key brain tests, magnetic resonance image, CT scan, and etc. MRI of brain. Let's have an MRI of brain. CT scan of brain. CT scan. CT scan of brain. MRI. So it is a MRI picture of the brain, and the other one is the CT scan of the brain. CT scan of the brain. Let's have an overview of the both of it. MRI scan are used for diagnosing neurological conditions like stroke, tumor, multiple sclerosis, infection, inflammation,